Hey guys, for this video we're going to talk about the trachea, the bronchi, and the lungs. So as an introduction, the thoracic cavity, which is what you're looking at right here, it's divided into three compartments. First we have a median compartment, mediastinum, which is where we're going to find structures such as the heart, which you can see here medially. That's actually the fibrous pericardium, but posterior to it you're going to see the heart. And then we also have two lateral compartments, basically where the lungs are. So these compartments contain the lungs, the pleural membranes, which is the one you're looking at right now, the thymus also. This is the thymus right here in blue. We also have the heart within the pericardial sac. This is the pericardial sac again. Large blood vessels that are entering or leaving the heart, such as this superior vena cava, and you also have this aorta right here. We also have the trachea, which you can see right there. We also have the esophagus. If I go to this plane, it's kind of like difficult to observe, but it's going to be posterior to the trachea. That's it right there. That's the esophagus. And we also have the thoracic duct. We have few blood vessels, not blood vessels, but lymphatic vessels, such as that thoracic duct. This is not the one, but this is just showing you a few lymphatic vessels, so you can imagine how they look like. And obviously we're going to have some lymph nodes, the vagus nerve and phrenic nerves. On this view we can see right here that one is your phrenic nerve. And we have the sympathetic trunks posteriorly in the thoracic cavity. Now let's talk about the trachea. The trachea begins in the neck at the inferior border of the cricoid cartilage. So this right here is the trachea, and this is going to be the cricoid cartilage. So as you can see, it begins in that border at the level of the body of C6. So this is C6, as you can observe right there. And so it passes through the superior thoracic aperture, which is, if you recall from my previous video, is going to be this area right here. And so it ends inferiorly in the mediastinum at the level of the sternal angle. So if you notice over here this is the internal angle in the mediastinum at the level of the sternal angle, which is right here. And it corresponds with the lower border of the body of T4 and or T5, which is right here at that level. It ends by dividing into right and left principal or main bronchi. If you observe, this is one of the primary or main bronchi. And this division is marked internally by the ridge of the carina. So the carina would be at the very end and is this right here. The trachea has these cartilages, and it's usually between 16 to 20 in number, to help to keep the trachea, specifically the lumen of the trachea, which is the space inside of the trachea, basically open and in a U shape or C shape form or structures. And this is made of this cartilage is particularly made up of hyaline cartilage tissue, and it is deficient posteriorly, as you can observe right here. If we go posteriorly, you can observe it's a C-shaped structure, and the posterior wall of the trachea is going to be flat, and it is composed of a fibromuscular membrane or a membranous wall. And posterior to the trachea, you're going to have the esophagus. Now let's discuss the anatomical relations to the trachea in the thorax. So first of all, we're going to talk about the anterior relations to the trachea. And so here we're going to find, for example, the thymus or its remains in adults, the arch of the aorta, which is this right here. We're also going to find the left brachiocephalic vein, which is this right here. Well, on the left side, my apologies. And then posteriorly, we're going to have the esophagus, which is this structure right here. On the right side, we have the arch of the azygous vein, the right vagus nerve, the right pleura, and the right lung. And on the left, there is the arch of the aorta and the left common carotid and left subclavian arteries, the left recurrent laryngeal nerve that ascends in the groove between the trachea and the esophagus on the left side. As for the principal bronchi, we have two. We have a right principal bronchus and a left principal bronchus. As you can see here, this is an example where you can observe the primary bronchus. So for the right principal bronchus, this one is wider and shorter in comparison to the left, and it's more vertical than the left principal bronchus, which is the reason why aspirated foreign bodies enter the right principal bronchus more often than on the left principal bronchus. It is also located inferior to the arch of the azygous vein, and it gives us the superior, middle, and inferior lobar. So we can also see right here secondary, tertiary bronchi for the corresponding lobes of the right lung. Now for the left principal bronchus, which is this one right here, this one, as you can observe, it's narrower, it's longer and less vertical than the right principal bronchus. It is located inferior to the arch of the aorta, and it gives us the superior and inferior lobar bronchi. So you can observe them also here, those bronchi and the bronchioles.